Hi there, my name is Khalid. I am a doctor from London. Today we'll be talking about the Brandt Daroff Exercises. Now, these are exercises I recommend for my patients who've got BPPV, so Benign Paroxysmal Positional Vertigo. Disclaimer alert, it's really important that you first seek your own doctor's opinion as to what you need for your vertigo. This is not really a video for self-diagnosis and self-treatment. Vertigo is a really complicated symptom, so if you haven't seen your own doctor, you should go and see your doctor about it. This video is more just to give those people who have been directed by their doctors to do these exercises. What we'll do is break down each step of the Brandt Daroff exercise so it's quite clear in your mind how to do it, and at the end I will let you know a few tips that I've learned along the way to make the exercises more effective. Before we start, it's really important that you are aware that these exercises can make you feel a little bit sick, so maybe have a bucket nearby just in case you have an accident, you don't want to ruin your carpets. It is also worth having a friend or family nearby if your symptoms are quite severe with your vertigo, so that they can help you safely get about afterwards. So important not to be driving or going anywhere after you've done these exercises. So, on to the main event. The first step is always to lie down on one side. I tend to go for my right side, and you can go for whichever one you prefer, doesn't really matter. But the key is that you have to spend 30 seconds in that position. So all of the positions in this exercise is 30 seconds each. Okay, so first thing you do, it's important head position wise. So yeah, head position wise, you don't want to get this angle and you don't want to get this angle. So you just want something in the middle of both. So that's about 45 degrees to me. And you want to just hold it for about 30 seconds. Now, at some point you may feel dizzy, and that's completely normal for this exercise. Just try and persevere and get through it. When you come back to a central sitting up position, that dizziness will improve. So come back to a sitting up position, look straight ahead, and then your second phase is 30 seconds here. So 30 seconds down there, 30 seconds here. And once that's done, we're going on to the left side. So 30 seconds on the left side, exactly the same position that we did on the other side. Can't fit because I'm a bit too tall, so I hope you can see this, and I'll try and get a second camera angle. Okay, so if you've done that for 30 seconds, you're going to come back to the center, and 30 seconds in the center with the same position, head looking forward, sitting up straight. Once you've done that, that is your first cycle done. That means you've completed cycle 1 of 5. You need to do this 5 times to successfully be treating it. And what you want to do is do this 3 times a day, so morning, afternoon, and evening. The period of time you need to do it in is 2 weeks. So if you do that consistently within 2 weeks, 3 times a day, and you've got the good technique that we've talked about today, and as I showed you with that angle from the side, then it's going to be very likely that it will help you. For the people that it doesn't help, it's really important you do speak to your doctor, because it may be that you need some other treatment, or it may be that the diagnosis needs to be reviewed. So for the people that have got BPPV, this is actually really effective. I give the leaflet out for this one all the time, and I've got that leaflet in the description, so if you wanted to have a look over it, you can do. So if you've asked me why these exercises work and what is BPPV, what is going on within the brain, so I guess to kind of summarize it, now that you know how to do the exercises, the condition BPPV essentially is a mismatch between what's going on in the inner ear and the brain. If we look at your inner ear, there's a pretzel-shaped structure, which hopefully is being drawn by me at some point on the screen. So this structure plays a key role in your balance, and it's filled with fluid and also has these kind of hair-like cells. And as you move, these hair cells are moving in the fluid inside of the canals, and that kind of sends messages to the brain that allows the brain to notice these movements with the input of your eyes. And what happens with BPPV is that within those canals you get extra crystals forming. Now, The problem with that is that these crystals, as you move, start bouncing off the hair cells, so that when you are still, the hair cells are firing off signals to your brain saying, whoa, I'm kind of all over the place, essentially. It doesn't quite fit with what the brain is getting from the eyes. The eyes are saying, well, dude, I'm pretty chill, I'm sitting here doing nothing. So that mismatch of communication is where the vertigo comes in. And if you listen to patients' histories, it classically is first thing in the morning, they've been sleeping, and as soon as they turn in the bed, you know, the vertigo symptoms set off. Or if they've been doing some housework or you know, painting, if they're looking up or suddenly looking to the side, it tends to be movement that is setting them off. With the Brandt Daroff exercises, what we're trying to do is shift all of those crystals out of the areas where you've got the hair cells, and we want to put them in an area that doesn't actually trigger off as much information to the brain, and it doesn't cause too much disruption. And if we don't do the exercises properly, you may get half of them through, you may get more of them, there may still be some that are causing problems for the brain. So that's why 2 weeks is a good period of time, and that's why 3 times a day is what's recommended. So I hope that's given you a bit more of a background as to what goes on and why these exercises help. There are other treatments. You can get medications that turn down the messaging system from the ear into the brain for the balance side, and there are a few different manoeuvres also. There's the Epley's manoeuvre that tends to be also used. The key take-home points from this will be that you've got to persevere with the exercises. They are super effective, I think in the late 90s in terms of how effective they are for BPPV, and it's really important that you use the right technique. So we talked about the actual head positioning, length of time you're supposed to spend in each position, and importantly, if it doesn't improve with doing this, you have to speak to your own doctor. So if it's not getting better, do go back to your own doctor and speak to them. Cool, hope you enjoyed that video. If you have, then please share it with anybody that you think might find it useful. Friends, family, colleagues, random person you meet on the street. That would be weird, but feel free to do that. We make medical health videos here and videos about my journey as a doctor in London. So if you wanted to join us and see what that's like, we would love to have you on board. Hit the subscribe bell, like, just hit a lot of buttons is the general summary of this, and we'll see you on the next video. Peace out. That wasn't so bad.